कभी नहीं हो रहा ये दिखाइए. Good morning. Fantastic. Dr. Utpal Joshi, the Vice Chancellor of Saurashtra University, was reciting a beautiful shloka. But before that, the Vedas have a beautiful shloka. Sharire jarjare bhute vyadhi grasta kalebaram aushadham jahnavi toyam vaidyo narayano hari. The body is full of problems and the medicine is Ganges water, and the doctor is like Lord Mahavishnu. So we are all fortunate to be equated to Lord Vishnu. It's a very sacred profession, and even today, the only profession which gets maximum respect in the whole society in the world is doctor's profession. So we are all very proud to be doctors, and you are going to be doctors if at all. Some people are interns or some people are final years, doesn't matter. But you are in this profession. So today, as our friend was saying, like Triveni Sangamam, whatever is it, all three of us would try to give our experiences. I don't know what made Dr. Kalpit to select senior citizens to be your speakers today. We are all above 60. We are all retired. But we are fortunate to have a lot of experience. So we try to inculcate the experience more than the knowledge, because you all have knowledge, right? So my part is about materia medica. Oh, I am only seeing. I don't need to go into the details of this. This is the dictionary meaning. This is the actual meaning. It is the record book. I am told by Dr. Kalpit that I should finish in 60 minutes. I would like to confine to 60 minutes. This is the study of drugs, materia medica, wherein we will scan through some fundamentals before we go into the practical application. So the prover's experiences, the clinical material, the chemical expressions, the toxicological findings, all these things are put in the record of these books, which you call them as materia medica. And in fact, Purkinje in 1829, he experimented on himself, but much before Purkinje, because Purkinje is recorded in medical records. Hahnemann's, though it is there, it has not been recorded in allopathic medical records. He did it in 1790. So how do we study materia medica? Study through source books. How many source books are there? Facebook, WhatsApp, Instagram, Twitter, source books. Allen's Encyclopedia, Hearing Guiding Symptoms, Richard Hughes' Pharmacodynamics, and materia medica, pure or chronic diseases. They are the source books. All the rest of the books which we know, they are all commentaries, experiences, expressions, all these things. And comparison at various levels. We try to compare the drugs at various levels. And then application at bedside. This is ultimate. Whatever is it. I keep fighting with my philosophy friends. Now I will fight with Das also. However, is very important, Argonon. I don't have any ambiguity about it. But you can't give organon aphorism number 1 to the patient. You have to give a remedy to the patient. So ultimately at the bedside, the drug has to be prescribed. So it has to be applied. Yesterday we were discussing, Dr. Tiwari, Dr. Das and all. I was telling about one thing, like I was reading the book on how to swim. I read it thoroughly, perfectly. So I jumped with joy that I know how to swim. Should I jump? I have to get into the waters to swim. So today, at the end of the day, if Dr. Kalpit's wish comes true, we three will push all of you into waters. You will swim. Sources of symptoms, lot of things like provings, poisoning, dosing, all these things. Then sources of mind symptoms, provings, doctrine of signature, toxicological, clinical, conceptual. Sources of materia medica, what are all the different sources? Pure sources, Hahnemann and all other provings or provers. Then impure, like guesswork, most of us do it. Doctrine of signature, chemical, clinical, poisoning. Then, like these are all the impure sources. Sources, if you see homeopathic materia medica, fragmenta de verbis is the first one. Then continued, all these people have proved so many drugs. Hahnemann was like Sachin Tendulkar, proved only 99 drugs, right? So these are all the different types of provings which went on all over the world. So many people have proved so many drugs. Then types of homeopathic materia medica. There are mainly two types, unmodified. The prover's expression is not at all modified. That is called unmodified. The second one is modified. Unmodified is Richard Hughes' Cyclopedia of Drug Pathogenesis. Not even Hahnemann's Materia Medica Pura. Then modified, schematic, keynote, pharmacodynamics, physiological, clinical, therapeutic, all these things. Then picture, comparative, psychoanalysis, approach through periodic table. Do you have pen mic or hand mic? Okay. Then modified, like you see the Materia Medica Pura comes in the modified Materia Medica in schematic. Schematic is like you arrange in anatomical schema and all that. So many books. Keynote Materia Medica, which is very important. Most of us know Allen's keynotes. Then you have got pharmacodynamics, Hampel and all that. Physiological Materia Medica, Burt, clinical Materia Medica, Farrington. I'm giving few examples, Dewey, therapeutic. Then picture type, M.L. Tyler and J.T. Kent. Then comparative, Farrington, Gross. Then psychoanalysis, most of us know Catherine Coulter, Philip Bailey, Rajan Shankaran, George Vitolkas. They talk about the drug personalities. And approach through periodic table, Ramesh Jain, Jan Scholten. Then scope of homeopathic materia medica, it provides a lot of information, lot of insight into each drug, provings, chemical and all that. Then it helps in treating different types of cases. Potency selection is also useful through materia medica. You have to bear with me when I am going in T20 style. Today evening again match is there, so I will be doing that T20 only, right? Second prescription, use of because let us try to see the practical point more than the theoretical point. Comparative, descriptive materia medica, therapeutic materia medica. Then it encourages research as well. Materia medica helps, like for example, if you see Baptisia, it helped in the research of Baptisia in the typhoid patients to see whether antibodies against typhoid bacillus would be increased. That has been established. So it will help in that. Then there are a lot of limitations. First limitation, all of us know, so many drugs, so many symptoms, we can't remember them. It is very difficult. And many drugs are not completely proved. Lot of pathological symptoms are not there. All the pathology, for example, round ulcer of stomach in Kali bichromicum. If it is described, it is a clinical expression. It has not been proved to produce round ulcer or a cancer in stomach, in Kali bichromicum proving. Then number of unproved drugs, partially proved, human provings, whether they were correct or not, there's a big question. Richard, you just criticized Hahnemann. Plant experimentation also missing. No editing. Everybody can write a Mathematica. Many people have written also. Emergency cases are missing. All these things. How to teach Mathematica? Most of you may be even from faculty. So the student is well versed with knowledge of applied anatomy. Anatomy is very important. We will try to understand that also. We cannot say the language of anatomy or study of anatomy is not necessary. It is very essential, though it is a very dry subject. Like he is expected to be aware of the expectations of patients from him. And he should be keen observer. Very important to observe. Relevance of anatomy. So it is scientific study of structure of body, and this is Mathematica. So do we really need? Yes, we need it, because Hahnemann told from 3rd, 4th, 5th aphorisms, it is very clearly mentioned, we should know the knowledge of disease and its location. We need to understand. So it has been mentioned. So medicine of experience, which was published by Hahnemann. So he said basic science of anatomy is very essential. And if you see Boger, he said seat of the disease. To know the seat of the disease, we need to know the anatomy. There's no hand mic. Then BTPB, if you see, he writes about location, sensation, modalities, and associated or concomitant. Location, how do we write the location? We cannot say just left. We cannot. So we have to describe anatomical position. So we need to understand. So location. Thank you. Right, I'll be very free here. So location is very important. Seat of the disease, even Stuart Close says. I told my friend Dr. Tiwari, the stage looks very deeper. So we need to come to the edge of it. Okay. Location and knowledge, affinity of drugs like chelidonium, liver. How do we say cactus, heart? Unless we know the anatomical position. Unless we know the expression. If the patient were to come and tell, I have pain here, this location, left loin. What is the main organ which is affected if it is in left loin? And if it is radiating to anterior wide. So you jump to a conclusion, it could be renal colic. How? Your knowledge of anatomy is telling you that this could be renal colic. So that is very important, right? Then the effect of one organ upon different parts of the body, like psychoneuroendocrine, this type of axis, it's very important. We need to understand. Every subject is very important, but today we are talking about anatomy. So even for the selection of potency, like if the symptoms are confined to skin, though it is the largest organ of the body, we give least importance. Even the nature gives the least importance. So the selection of potency, we don't give a highest potency in the cases of exclusive skin diseases. So the potency selection also depends on anatomical description of the disease. Then scientific assessment of treatment, like the fibroids, PCOD, all these things, we can assess them clearly. What is happening, what is it getting damaged, how is it going to affect and all that. Clinical examination is very important. Like these are all certain examples. If the fontanelles are affected, suddenly why do we say calcarea, silica? We know they have the affinity on these anatomical organs. If you see the parietal lobe, occipital lobe, for example, if somebody says, I have pain in the occipital lobe, gelsemium, why? Because we know the anatomical expression of that drug. So the Mathematica is interlinked with anatomy. If you don't have the knowledge of anatomy, you can't understand the drug's expression of symptoms. Lot of brain remedies. Alumina, argentum, avena, all these things. Then eyes, lacrimal duct, for example. Silica, most of the times lacrimal duct is closed. The child watering is defective. It is coming down completely. So though we say the maneuver, you just do this maneuver in the inner canthus. But at the same time, we give a drug like silica, because it has the affinity. So that is very important. Then LNSA. There are drugs like antimonide, lycopodium, phosphorus. Or the location of these lungs. Most of the greatest authors of materia medica were anatomy teachers, including the recent doyen of homeopathy, Calcutta, Dr. S.K. Dubey was an anatomy teacher initially. Dr. J.T. Kent was an anatomy teacher initially. So they knew anatomy thoroughly. Then they applied it in materia medica or vice versa. So these are all the lung muscles, arnica, causticum, lactic acid. And then knuckles, antim crude, colophyllum, causticum. Then nails, antim crude, anthracinum, arsenic, calcarea floor, so on and so forth. So these areas also, if uvula is there, some people come and uvula is elongated, it is touching the inner part and it is causing irritation. So you have drugs like bromium, croton-tig, HomoeoSeminar and all that. Then esophagus, these are the drugs. Then if it is stomach, other drugs. Liver, gallbladder, rectum. So the location wise and even urinary system, just examples I am telling you. These are all the areas. So what is your conclusion about anatomy and materia medica? Inseparable, very essential. So we need to have definitely the knowledge of anatomy. But with the knowledge of anatomy, don't compartmentalize. We can't do it. An ENT surgeon will never look into the eye problem, though it is nearer to nose. But we should not become, right? So we need to understand that. Now, importance of pathology. What is its importance in materia medica, in our clinical practice? I'm trying to touch upon two important subjects, one preclinical, one paraclinical. Then we'll come to clinical. So the pathology, most of the times, earlier days, at least during our clinical, like training or teaching or studying time, people used to say, homeopaths don't need to understand pathology much. Take the symptoms, prescribe the remedy. But if you don't understand the pathology, you can't prescribe a right remedy, you can't understand the prognosis, you can't see the development in the patient. So like, for example, a case. This is a case of cholelithiasis. He's a chronic patient. He was with me. I have given him Nux vomica earlier. So he had a lot of problems. Then he went to even ICU also. There also he said he did not take any allopathic medicine and all that. So he had a lot of confidence. So he was diagnosed to have cholelithiasis and he was referred to cardiologist to do the surgery. But he was reluctant. He came, this was here, cholelithiasis. Then we have given, already he was on Nux vomica, it was his drug. I thought I can give Nux vomica or its satellite remedies. But I thought he did not have, it was an accidental discovery. And with only one single symptom, small one, why should I give unnecessary all constitutional remedies? Let me give a specific remedy. Like, what are the specific remedies for gallstones? Any choice? Colestrinum. Feltori, colestrinum, chelidonium. You have drugs like which are very essential, Berberis vulgaris. Those are all the drugs we have given. And when we have seen in the shortest period possible, in 21 days, the stones were passed and he became all right and the surgery was averted. Importance of pathology. There the pathology is of gallstones. Basing on the pathology, the drug was prescribed. And here there is one case, 13-year-old boy developed seizures and he had an aura of blurred vision, jerking of right hand. It was diagnosed to be tuberculoma of brain. So this is tuberculoma, tuberculosis which conglomerates tubercles into a firm lump in the brain tissue. And after 7 months, again he developed, it was confirmed with MRI as tuberculoma. So he was already put on AKT. In spite of AKT, he developed seizures again. They said it would continue. You continue the treatment, seizures might come. Past history, nothing relevant. Personal history, nothing great. Thirstless only. Stubborn child, wants everything according to his will, does not obey. So granulomatous lesions, tuberculoma. That was the diagnosis, even pathological diagnosis. Repertorial chart, he was admitted into my ward in the hospital. Causticum was the remedy. Now there was one question in our minds, does it cover the pathology? Kent writes in repertory, sir, I am entering into your subject. In preface, where he says, if the drug does not cover the pathology, it may not cure the patient. May not, most of the times. You have to cover the pathology as well. Most of the times it happens. It covers. If it does not cover, it has not been included there. That we will see in a case, right? So we checked. If you see in Robin Murphy, tubercles, causticum is the only remedy. One lady was asking me, a child clinic, the mother says, हर रोज देख रहा हूं मेरे मंदिर में विभूति खत्म हो रहा है. मैं चूहा बोल के समझा पहले, बाद में देखे तो मेरे बच्चा खा रहा है. Desires vibhuti. Only one drug is there in repertory. That drug was given. Became all right, completely. Right? So, single drug is very important. The drug is, anybody guess? It is mere guesswork only, because you have to check. Now you have in your mobiles, no? When I used to be in my college there, if I get an answer after 1 minute, it is from Google or it is from the mobile. If it is not immediate, it is not the student's contribution. Anyway, it is tarantula. Okay. So here, single drug is very important. And it has come up even in the repertorial chart also, after all that. So we have given tuberculum of brain. This was in our hospital, government hospital. And we have given causticum. To start with tuberculum 1M, we have given before we came to conclusion of causticum. Then causticum 0/1, 0/3, 0/6, 0/9, 0/12. And on 23rd June, because homeopathy works slowly, it took 3 months to cure tuberculoma of brain. It takes 9 months for allopathy to cure. So because we are very slow. So within 3 months, the tuberculoma has vanished. This can happen even if you depend on the pathology. So pathology is inseparable from materia medica. It is inseparable part of materia medica. It is there. There are certain drugs which are not explored to that extent. So we need to understand that pathology is very important. Case number 3, this is a very important case, 30-year-old case. Dr. Kalpit asked me, sir, let us discuss more cases. So you will bear with me. So, dry gangrene, pricking pain, aggravation, cold air, sore, fear of someone touching the toes. It was diagnosed as SMA syndrome. Okay, superior mesenteric artery syndrome. That was the diagnosis. Bypass was done, and she developed complications like Klebsiella pneumonia. She was shifted to ICU. In the ICU, on the ventilator, On second day, she developed dry gangrene of 9 toes. So cause could be severe injury to abdominal aorta, thrombosis. That was the conclusion by the surgeon who did the operation on the superior mesenteric artery. So this is the case, right? Superior duodenum is compressed by the superior mesenteric artery against the abdominal aorta. Here, this is the superior mesenteric artery is the one. This is superior mesenteric artery. This is the duodenum. This is the abdominal aorta. This is having an acute angle. This is a normal one. The duodenum is good here, but here it compresses and makes difficult for the food to pass through. They develop severe abdominal pain, vomitings, everything. It is like an abdominal crisis. So this is what SMS syndrome, and nausea and vomiting. There will be compression. Weight loss will be there. They are afraid to eat. This is what a prompt diagnosis is essential. We have given arnica 1M. The cause, it was presumed caused by the surgeon. It could be an injury. Then, what was she expressing? She was apprehensive that somebody might come nearer and they may touch her toes. That is a typical description given in Materia Medica about arnica. So we have given, it has gone up to CM also. You can see these are the toes. Actually, this I call as homeopathic amputation. Every 2 weeks, one toe fell off on its own without even touching. We have not applied any external application. So this is how it happened. It was based on the symptomatology and the pathology as well. Arnica has tremendous capacity to remove the effects of injury, to remove the compression problems and the circulatory deficiencies and problems. So that was the drug of choice, and it helped. Now we will see the different types of prescription. After we know the importance of anatomy and physiology, the pathology, now the Materia Medica. Now ultimately, as I was telling, like, we have a great respect, anticipation, and expectation from the public. As a doctor, we need to live up to their expectations. And however much, like me reading how to swim and jumping into water and drowning, it should not happen. So we should apply our knowledge of Materia Medica into clinical practice. That's what, like, we will try to see through different types of cases. What are all the different? These are all not watertight compartments. These are all like the collection of different people's expression, experience, and my own experiences. The different types of prescription. Like this we know, there is a beautiful sloka. Akashat patitantoyam yadha gacchati sagaram sarvadeva namaskaram keshavam pratigacchate. The water, whatever drop falls on the earth anywhere, has to reach the ocean. So wherever you pray God, it has to reach the Keshava. Similarly, whatever the method you adopt, कुछ भी करो, ultimately क्या होना चाहिए? First aphorism. Thus, sir, the physician's high and only mission is to cure the sick. That is very essential. We need to understand that importance. So here, now, what types of prescriptions, how do we do it, what should be our approach? Hahnemann laid down very clearly, where he said, whenever the case comes, take it perfectly and put it into the slots. Like you go to a general post office, the fellow gets lots of bundles of letters and he puts into the slots here according to the locations. And those slots he takes and gives it to that delivery man, and he reaches that place and he would deliver very easily. Similarly, Hahnemann classified, depending on the expression of the disease, into classification of diseases, and that made it very easily. So we need to do it like he classified basing on nature and expression of the disease. Indisposition, surgical, dynamic. Indisposition. Can anybody give me a hint 5 minutes before the conclusion? Because I can conclude it, right? Dr. Kalpitji, right? All of you would do it now only. I should trust only Dr. Kalpit. Right. In this position, we need to do nothing here. And surgical, we have less scope. Dynamic, we have acute and chronic. And acute, individual sporadic epidemic. Lot of things, chronic. Then, what do we need to do? First, identify the case. After you take the case completely, what sort of case is it? Then your approach would be defined. Then you can, like when we talk in the language of cricket, when the batsman is standing here, he would see the delivery and he would decide then, is it to be hit out of the ground or into the ground, left side, right side, offside, leg side, these things. Similarly, when the case comes to us, we need to understand after taking the case thoroughly, perfectly, and then we can do it, definitely. So, basically there are only two types of prescriptions, first or second. Yesterday we were discussing, like one of my friends used to say there is no second prescription because he never had a successful first prescription. But we need to have a first prescription, which has to work. Second prescription, Hahnemann said remedy reaction. Kent laid down those 12 observations for the second prescription. When once the drug has acted, it has elicited some response from the body, or it has not elicited a response, then what to do? They are laid down. But when the patient comes for the first time, how do we approach? So that classification of diseases, depending on the classification, we can definitely do it. So it is several types, like approximately 16 types of prescriptions are there. All of them, you are aware of it, and I already said they are not watertight compartments. An acute remedy can be a remedy which is given in an epidemic also. So it can be. We don't know it, right? And a chronic remedy can be a miasmatic remedy. Acute prescription, like acute bronchitis, most of the times antiemmetic may be prescribed. So what are needed? Observation, very important. We need to observe the patient in acute diseases. Don't be a clerk. Don't just sit down, write down, अच्छा बोलो, वो बोलते जा रहा है. उनके फेस में एक्सप्रेशन क्या है? कहाँ दर्द हो रहा है? कहाँ हो रहा है? एक पेशेंट ने आया है, मुझे किडनीज में बहुत दर्द है. तो ये बंदा ने लिख दिया पेन इन किडनीज. कौन सी किडनी? लेफ्ट या राइट? दोनों में. अच्छा, बाइलेटरल पेन किडनीज, बेरबरिस वल्गारिस दे दिए. हालांकि ही इज थिंकिंग टेस्टिकल्स. So he is already showing with his hand, but this fellow is writing down. So this is the problem. Let us not be clerks. That is not our duty. Let us see the patient, observe, note down carefully, and then prescribe accordingly. So the causation is very important in most of the acute conditions. Like we have a case, 43-year-old gentleman, extreme weakness, severe headache, fever since 2 days, profuse sweat, loss of appetite, thirst moderate, arsenic I have given, RT-PCR was asked during COVID, it came positive on 30th September 2020. HRCT chest, Corax 4, confirming the diagnosis of COVID. So here, there was only one beautiful symptom. He was scolding everyone in the house even without any reason. Most of the husbands take this as an opportunity when they are sick. So please bear with them. That is common. But she didn't know it. She was thinking it is as a symptom. I also jumped with joy. It is a characteristic symptom. I prescribed a remedy which has the same characteristic feature, ferrum metallicum. It was given, and on 6th day, the RT-PCR became negative. Usually it does not take that less time. So it is an acute one, promptly given, promptly acted, and promptly responded. So that is an acute disease. There is an advantage and disadvantage with acute. The definition itself says either it ends with the life of the patient or it recovers completely. So if you are fortunate, it recovers. Then etiological, the causation. What is the cause? Most of the times injuries, arnica. There are many drugs which have injuries. Abdominal injuries, most of us ignore. Belly spur, beautiful remedy. So likewise, head injuries, most of us ignore natrum sulph. It is one of the best remedies. Mental symptoms after head injuries, natrum sulph. So there are many drugs which we have to think. The cause and the effect both should match for us to act correctly. So etiological, severe pain left elbow since 1 week and drawing, pulling, aggravation evening. He tried a hot fermentation, nothing. Software engineer, working from home. X-ray did not reveal anything. 1 week back, his bike failed when he was coming home. He carried a heavy load to his house, almost a kilometer. Next day onwards, he developed pain. Is it not Rostox? Carrying weight, causing pain. So went a little further. Only one drug, chamomilla. Pain elbow after carrying weight. Single drug, Dr. Vibhuti. You both were asking. Single drug, single rubric. Single drug rubric is very characteristic. Dr. Tiwari would talk about repertory later. So, chamomilla was given, he became completely all right. Chronic, most of us claim that we treat a lot of chronic diseases. We cure them. There are many successes under each one's belt. It could be possible. So what we need to do is like we need to take the whole case. Like aversion to the caution, 34-year-old lady, lazy person, hating her husband. She used to cry. This was the case. This lady, 34-year-old, comparatively young only. Nowadays, people are getting married at 34, right? So this lady, she used to yell upon others if there is a sound, a lot of anxiety. She was feeling she would become mad. I will become insane. Then the past history revealed that she lost her beloved uncle 12 years ago. That was the thing. So grief also there. And she was hypothyroidic. TSH was above 50, which should not be more than 5.5 in any lab. Some labs give us 4.1, 4.4, depends. But in any lab, it will not be more than 5.5. The textbook of endocrinology says until it crosses 7 TSH, don't need to treat the patient. Put them on lifestyle modification. That's primarily. But this is the lady. So here, graphites 200, which is common for thyroid dysfunction, but when the repertorization was done, graphites only came up. And TSH showed normal values, menstrual cycle became all right. This was 50, and later on became 1.35. The other type of prescription is constitutional, which many of us believe we are trying to do it. But in words of Dr. S.K. Dubey, when he came to our college, I requested him to address my PGs. And it was just an extempore. And he spoke for only 1.5 hours. So, he was telling like, he was trying to understand the constitutional materia medica at that time, when he became very aged, a doyen of homeopathy with a lot of knowledge of materia medica, a keynote prescriber. So once his father gave him a gift of 3-piece suit, and he was wearing that 3-piece suit. And most of the times what happens when you wear a new dress, new sari, new suit, new pant, you will be very careful. You will try to sit in any place, cleaning it, and you won't sit in every place, and you will be very careful. That's how we try to do it. We try to take care of our dress, especially if it is new. So he was trying to take care and all that up to lunch. बर्दाश्त के बाहर हो गए. अब बोलिए मेरे से नहीं होता. तो सीढ़ियों पे बैठ गया, पूरा धूल मट्टी. जब चक्रवर्ती साहब, B.N. Chakravarti साहब, I think he was going by that side in the college, he said, look at sulfur in three-piece suit. Then he could understand he was sulfur. He retrospectively thought later, whether it is true or wrong, the persons who were close to him, probably Dr. Das or somebody might tell, but that's how, like the Constitution. Most of the times we are told different things, like sulfur likes rag things. It is not like he wears a torn shirt. He doesn't need to. The greatest point of discussion in sulfur is that they have lot of possessive nature. If I like this, I won't leave it. Whatever is. I exaggerate about the things which I like. That is sulfur nature. Anyway, so here we try to understand the constitution of patients. Constitution is like physical, social, moral, everything, ethical expression of that particular nature, disposition, symptoms, everything. Not just expression of symptoms. So that if it fits, he will be definitely cured to a greater extent. So this is what, like one case where 43-year-old man, loss of appetite. Your appetite was more, thirst less. His lipid profile was little haywire. He has become very lazy and mildness, wants company, drowsiness, sleepiness, lethargy, obesity, thirstless. These were the rubrics which we have selected, depending on other qualities also. I can't take everything there. So Pulsatilla 0/1 was given for 1.5 months. Dietary instructions were also given. He was through and through Pulsatilla also. He was, every time he was looking, he came along with his wife. Wife is a Telugu actress, cine actress. So he was looking like, she in fact jocularly said, I at times, he was in ONGC. She said, I in fact feel at times, am I the actress or he is the actor? So he acts more. That's how, like, the lipid profile became all right. It was STG 216, came to 162. The other one is intercurrent. Most of us do use. It need not be nosodes. It can be a drug which is indicated in between, like sulfur can also be an intercurrent. If at all the drug has acted to certain extent and it has stopped their action, then you can give an intercurrent which can propel the action later and so that it works later. Then the same drug might act or this will act continuously. That's how it is being given. Then miasmatic, I take the liberty of taking a case from my wife's archives, her case, which is a beautiful depiction of miasmatic description. Like 18-year-old girl was complained to have not attained menarche. 18-year-old girl. So this girl, no other symptom. Gynecologist said they would at least do some prosthetic surgery so that she can have some sexual life. There were few structures which developed, many structures did not develop. Mullerian agenesis, this is what called as in diagnosis. And this was the scenario. And if you see the ultrasonogram, uterus and ovaries not visualized. They were not there. Then it continued. CT scan also revealed nothing. There is like unlikely to represent uterus and is likely to be bowel loop. That is what the description. Then totally shattered. Gynecologist, nothing can be done. So she is in fact my senior pharmacist sister's daughter. So they said, you do anything, doesn't matter. First of all, it is free of cost. Second, got vexed. So do anything. So she got vexed. What is the miasm? That is Dr. Das' description, but I am entering into your arena. Syphilitic. Don't say syphilis. It gives a wrong opinion because I teach medicine also, very difficult to understand that. So, scope and limitations, these are our scopes and limitations in homeopathy, according to Hahnemann. So, we have a limitation in such case. We cannot say, assure that we can do something great. So, here she was given Syphilinum 1M. SL for 2 months. Then she started developing axillary and pubic hair, which was not there. 18 years, all these things were not there. Now after homeopathy, it is not coincidental. Somebody cannot claim that it has just happened. And she was kept on saclac. Slight enlargement in her breast. Saclac continued.
Check.
So, she came to know illicit affair in her husband. She had a lot of tension. So, Syphilinum 1M 1 dose. After some days, the scan was taken where at the cranial end of the cervix, a tiny, apparently rudimentary uterus-like structure, now slowly developing. Severe uterine hypoplasia, later on the CT scan, after some time. Non-visualization of ovaries, they did not. Then slowly, hypoplastic uterus, at least some size, non-visualization of ovaries. Then around this time, she attained menarche. We were in Katra, she attained menarche. We got a phone call, Madam, आप कहाँ हैं? हम function करना चाहते हैं. So this happened after a few months of Syphilinum 1M 2 doses. Antiverted normal sized uterus, small right ovary, non-visualized left ovary. This is all just because of 2 doses of Syphilinum. This is miasmatic prescription. Right? Wherever she is, she would be very happy. She is now married and blessed with a baby boy. I attended the cradle ceremony. Marriage also, of course. So, don't ever say that cradle ceremony did not come off without marriage. Okay. She asked me to wind up in 2-3 minutes. Okay. Nosological, depending on the diagnosis. This
You can carry on, sir. You
For
can
Home-
carry on with the cases. We will have a discussion later on.
लोकसभा जैसे मेरे फोन कट कर दिया ठीक okay so here this was diagnosed to have thrombocytopenia. What is the best remedy? Ophidia group, there should be hemorrhages. Then arsenic. थोड़ा जोर से यार. I'll tell you a drug which is prepared from leech. लीच क्या करता है? आपके खून चूसता है. क्या ड्रग है? What is that remedy? Starts with S. Second letter A. Third letter N. Fourth letter G. Fantastic. Sanguisuga was the remedy which was given to this lady. Thrombocytopenia 46,000. We have given Sanguisuga. Nowadays it is not available in mother tincture form. I am finding it difficult. So platelets 43,000. It came to 1.2 lakhs, 1.3 lakhs. We are treating her for other things. Like here, organopathic type of prescription. Organopathic. Who coined the name organopathic? Much before Burnett, Bonninghausen raised that point. He said, organopathic description is very important. Right? So, here, serum bilirubin was 4.8, nothing great symptoms, all just common symptoms. So, we gave chelidonium mother tincture without breaking head, and it came down to normal value. Pathological prescription, I already showed few of the cases there. I don't need to show them again. One other case like 42-year-old, pain abdomen. And here, this lady developed FTND, specific desires and aversions were not there. And she was advised to undergo hysterectomy. Fibroid uterus was the diagnosis, which is a very common problem nowadays. So here, she was already given so many drugs by earlier homeopaths. So I thought I would give very specific remedy, AMN 3X and Fraxinus mother tincture. Nothing else was given. This we have given, and there it was bulky uterus with focal adenomyosis, then only bulky uterus. Adenomyosis has disappeared with those local remedies, or you can say the lower potency remedies which were based on the diagnosis. Then synthetic, which is common in Bombay style, synthetic, right? This synthetic prescription is like, of course it is very difficult to understand, and we all usually fight with them. Like if, for example, somebody is having natrum mentality and arsenic physical expression, they give natrum ars. It will not be correct, because natrum ars is a different drug which has a different drug picture. But I will give you a very contradictory case here. So here, some dentist, one lady dentist, 32 years, frequent cold, frequent attacks of sneezings, blockage, bothersome problem is nasal obstruction, diagnosed as nasal polyps, lot of problems, post-nasal drip, frequent attacks of throat infection, follicular tonsillitis, and pain throat, cold, aggravation lying down, appetite, thirst, all these things, unsatisfactory stools. Sleeps on sides, periods irregular, dysmenorrhea, mild hirsutism, small uterine fibroid, PCOD, desires ginger and garlic, antidepressants she uses, sorry, low backache, left renal colic, and calcium, that calculus, tinea infection also nowadays. She is a museum of problems. She has everything. She is a doctor, in fact. And so, hypothyroidic. She is already on 50 micrograms thyroxine. Father, mother, PTB, CAD, they are all there. Epistaxis during childhood. Cervical lymphadenitis. TB was negative. There was an accident in California. Head went for hyperextension when she was trying to take nasal drops in USA in 2014. She was trying to put, how much she can build, I don't know. God only knows. This is first and last case. So here, it went for hyperextension. She had a lot of problems. So spine injury, C5, C6, 7, quadriplegia, was on bed rest for 1 year in America itself. Okay? CTPNS, all these things. IgE, 219 only, not much. Lone daughter, never felt the need of any brother or sister. Father has pampered a lot. Smiles when questioned about boyfriends and says, nowadays it is common. Who does not have? This is the answer. Very intelligent. Says she would love to go back to USA if her health improves. Smokes imported cigarettes 5 per day. Takes scotch weekly once or twice. She is afraid of infection and needles. Dental surgeon, needles. So that is the problem. So I have given, basing on all these descriptions, I have given tuberculinum. Results showed phosphorus. But to my knowledge, to my gut feeling, she was looking like a tuberculinum. She is not like that type of ethereal, smarty, like a phosphorus. I thought she is more tuberculinum. Phosphorus is also tubercular. But tuberculinum has that type of expression. So I thought, I gave. There was no improvement. Then I had to discuss this with my friend Dr. Anwar, whom I lost, unfortunate. So Anwar, in Bombay, we used to have that discussion. After NGH seminar, we used to sit the whole night, and I used to catch the first flight at 4:45. So for whole 3 hours, we used to sit at Juhu Beach and discuss different types of cases. This case I discussed. He said, "Arey yaar, calcarea fast though, that would work." When I checked the repertorial chart, calcarea and phosphorus were second and third drugs. ये भी देखेंगे करिश्मा क्या होता है, करिश्मा करीना क्या होता है देखेंगे. तो I have given calcarea fast. You can see here calcarea first, phosphorus third. ठीक है भाई, दे देंगे. So I gave. There was tremendous improvement. Now she is in US. She has gone back to US. She is practicing there. She is a dentist in Los Angeles. Whether she is still alive in those fire flames or not, I don't know. Anyway. Now tautopathic, most of us know it. And in fact, in the words of Dr. S.P.S. Bakshi, he was arrested because cortisone 30 tablet bottle was available in Kolkata Baxan Clinic. So we have these allopathic drugs being converted into homeopathic potentized remedies. That is tautopathic. Then past history based, some clear-cut past history if it is there, you can prescribe. What is my intention of telling you different types of prescription is that like Materia Medica has different types of expressions in different ways and means, your symptoms and all that. When you look at them, you feel lost in that jungle. How do we apply them? This is what like I request you, all of you, when you read the book, try to imagine the patient in front of you. How can he express that symptom? Then you will understand that symptom very well. How can he do it? Like for example, I'll give you one example. One gentleman came to my clinic. You will tell the drug immediately if I tell you what he did. He came and said, "Doctor साहब, बहुत दर्द है, 2 घंटे से मर जा रहा हूँ, बहुत दर्द है." He jumped the queue, jumped the number. He came in, came in and he said, "कुछ तो करिए, मेरे पास ज़्यादा वक्त नहीं, मैं मर जा रहा हूँ, जल्दी दवा दे दीजिए." What drug do you give? Everybody would give aconite. He's telling, जल्दी दे दीजिए, मेरे पास वक्त नहीं है, मैं मर जा रहा हूँ. This is the Materia Medica language expressed in terms of patient's expression. So that is what like, these are all different cases, our little experiences for you to understand the Materia Medica language. You can apply them. As I'll give you one more example, like one vegetable vendor, she was selling the vegetables, keeping that type of thing on the basket on the head and selling in the street, in the village. There was one adult education program and she joined in that adult education program. After 15 days of adult education program, she learned certain English words. And he tried to convert her vegetable names into English words. And she started selling in the village. Bottle gourd, bitter gourd, she started selling. Earlier she used to say kaddu, karela. Now she started selling in English language. Now what is her drug? No. First you should understand what is her feeling. What is she doing? Don't tell me the drug. What is the feeling? Why? Why is she selling in English language? Huh? Like. Fantastic. What is the remedy? Platina. Fantastic. You got the point. She wants to be in elite group. She felt speaking in English, she is elite, higher level. So I sell my vegetables in English language. She may be a vegetable vendor. But what is she showing? I am the queen in my clan. That is platinum. So apply. That is what like applied material medical, live material medical. See the patient, how he is expressing. Like Dr. S.K. Dubey, what he said, like sulfur in three-piece suit. Sulfur need not have a torn shirt. He can be even in three-piece suit. Likewise. So here, past history based, 16-year-old girl, she was brought, beautiful girl. Her mother was the principal of a junior college. And when she was brought, I asked her, what is your name? She said, Merci. That first syllable, she was stressing. You have a beautiful rubric, first syllable being stressed in stammering. So you have drugs. So likewise, many drugs were given. But when the past history was asked, here, the mother suffered with diphtheria in her 5th month of her pregnancy. And she was admitted to fever hospital. She was given anti-diphtheritic serum as well. Diphtheritic organism has got side effects on the vocal cords. So, diphtherinum tenem was given to this girl and she became completely all right in few months' time, 5 months or so. Family history, this is a beautiful case as I was telling, like certain pathological expressions are not mentioned in our repertory or materia medica. Here one girl was brought, this girl 6 years with severe headache for the past 1 year and vomiting does not relieve. She was diagnosed to have migraine. She was given certain drugs which are very powerful. The father is a dentist who was treated with me for, like this girl was operated upon for arteriovenous malformation in the cerebrum in her 3rd year, this girl. And the father had AIDS, almost on deathbed. He was almost declared dead. The relatives were told, take him home. Because most of the corporate hospitals tell you, please take him home, he will die in midst of you. You will feel emotional. But basically they want to save their statistics. That is the problem. So, on the way to their house, he was stopped at my clinic. We have started the treatment. We have given. He became completely cured. He became negative. But he requested that his case cannot be shared anywhere. So he did not allow me to use those reports also. That was my first case, much before Crotalus horridus experience. So this case, this girl who was given Sibelium, some other drugs, he was afraid to use them. He came with the girl. Then I gave Crotalus horridus 30 to this girl, migraine girl. And after 1 dose, for the past 3 years, the girl never had a headache. Crotalus horridus is now being used for HIV/AIDS. After that ISCT experimentation which we have a beautiful specialty clinic in Hyderabad JSPS also. And I am proud to say here, more than 58,000 patients are registered in our college there, HIV/AIDS patients. So, that's how it is still going on very well. So, this is like the family based. Preventive, everybody knows. Palliative, there was one case where we have given as a palliation chelidonium and cancer duodenum. We have given the drug. Then the last one, some last case I would like to share with you, the keynote prescription. This is the last case. Keynote prescription is very important. One case, I was asked to see the patient, 3 minutes. I was asked to see the patient, glioblastoma of brain. She was almost like about to die. She was taken home. I was called to see. When I have gone there, she saw the daughter-in-law and said, please chale jao, please chale jao, please chale jao, please chale jao. Then I thought she is against her daughter-in-law. But later on I came to know that she is afraid to see the red color, red dress. What is the remedy? Only one drug. So I came to the college, verified the repertory and gave that drug. Believe me, she survived for 1.5 years without headache and died later. It was one dose of Alumina 200. Alumina is the remedy. It has that. So that is keynote prescription. Single drug, madam, you asked. Very important, right? So here, this is the case, last case. A lady, 43 years, diagnosed as DUB, developed severe menorrhagia. She was having severe symptomatology, severe menorrhagia, advised to undergo hysterectomy. 2 senior-most homeopaths also treated. There was not much of improvement. Sepia, Pulstilla, Thalapsy, Millifolium ferrum, Lecithin, many drugs were prescribed earlier. So she did not get any relief. I also gave Calcarea because those 2 senior prescribers were my teachers. I know their prescriptions, so I thought they didn't give 50 millismol. So I gave Calcarea Corp 0/1, seeing her constitution. It also did not work. Later, there was one beautiful symptom. She said, I never use pads. I said, please come again. Yeah, I never use pads. What does it mean? Means, she said, all that menorrhagia, severe bleeding, she gets only when she goes to the bathroom. So, menses only when urinating. It's a characteristic, peculiar symptom. The keynote word was coined by Guernsey, not Hahnemann. Hahnemann said peculiar, queer, rare, strange, characteristic feature. He said, but Guernsey mentioned this name. So this keynote, what he mentioned, bleeding only while urinating, menses when not, like menses urinating only when. Only one drug in 3rd grade, proved by Hahnemann. Only in Allen's Encyclopedia it is there. This is called Magnetus polus australis. So M.L. Tyler says there are 3 types of prescribers. Scientific, which most of us, artistic, some of us, intuitive, very blessed people, right? With their experience and knowledge, they are intuitive prescribers. Conclusion, so we need to take the case completely, perfectly, put them into different slots and understand what type of case are we dealing with and what type of prescription do we need to prescribe, then we need to know it. Ultimately, the court of appeal is materia medica. It tells you what drug should be given in what type of case. It helps you, right? Thank you. If you have any questions, pass it on to Kalpit. Thank you very much.
Thank you, sir. Thank you for a wonderful series of cases, and I really appreciate the aims. We will take almost a discussion session at the end of the day. We have 2 hours for interactions with all of you people. But can you, sir, tell me in one line, if you can say, there are a number of cases with a number of different approaches, from anatomy to keynotes, right? From analytical to essentials to things. Do you have in mind when case comes to you, what prompts you to select any one approach for a case?
No, I don't have that type of thing. But basically, when the patient tells us the symptoms, so we get that clue, what sort of case is he expressing, is he telling us. And when we jot down, we will understand whether are we dealing with an acute case, or are we dealing with a chronic case, or are we dealing with some case where there is like one-sided disorder, where we may not get any characteristic features, so the approach may be different. So depending on that expression, it all depends on patients. They are gurus, they will teach us.
So patients are the best teachers. Actually, patient guides us and defines us what keys which we will select. It is so many times there is a confusion and question of students, especially who are attending somebody's or somebody else's clinic, and there is one method and approach is going on. What about the other approach? So there are various approaches and methods to reach at the prescriptions, reach at the medicines, reach at the solving the case. You should keep your mind open. So we have seen number of examples. There is a pathological prescription. If pathology is not covered, then it is not going to cure. See, basically medical science is an open science. So I wanted to keep that forum to raise your queries. We can ask sirs, and that is a method actually what we are going to study. Sir has also mentioned that repertorial single remedy. Then you are blessed. If you find out the characteristic symptom, you are blessed. Why I get that remedy and I prescribe that and a miracle happens. What made me becoming homeopathy is such kind of blessed cases which boosted my confidence in my learning time. I'll share it in the discussion session. But before that, without going further, I thank you very much, Dr. Praveen Kumar sir.
Thank you very much.
Loud applause for sir's marathon cases with all different approaches. He said कि sir क्या करें हम लोग discuss करते थे. मैं तो students has a query कि हम लोग anatomy पढ़ रहे हैं, pathology पढ़ रहे हैं, ये पढ़ रहे हैं, इसका importance क्या है even in homeopathy practice. So that sir has effectively and efficiently delivered the things and the concern. Thank you very much sir. I invite उसमें sir ने बोला repertory कौन सी repertory? There are number of repertories. Yeah, memento at the end of the day. After the debate. Yeah, we need to facilitate you with the mementos, beautiful mementos. You can keep in your clinic. So repertory is a very technical term. There are many people who is using lot of different types of repertories. આપણી પાસે આટલી બધી રેપર્ટરી છે તો કઈ રેપર્ટરી ખાલી એક્ઝામ માટે આપણે વાંચીએ કે ટાઈપ્સ ઓફ એનાલિસિસ ઇવેલ્યુએશન શું કરવું અને કદાચ રેપર્ટરી માટે જેમણે આખું જીવન આપી દીધું છે. The whole life he has given to the use of repertories and types of repertory. The repertory, it doesn't mean only repertorization. It extends lot of things. And you will be happy to learn that Dr. Tiwari sir has an extensive practice in Bangalore. And the way he has established, he started his career as a lecturer, then proceeded to as a post of principal also in the Father Muller Homeopathic Medical College. And then he retired and practiced over there. And he is delivering number of paper presentations in national, international media. I met him in the Leipzig, I think, the first international conference. We discussed a lot of things. And sir has a very pious understanding of the subjects, and I had high regards and respect for him. I said, sir, I'll call you in the Rajkot for my students and my faculties and the practitioners. So welcome, sir. Welcome, Dr. S.K. Tiwari, sir, the author and the international speaker, Dr. Shashikant Tiwari. Thank you.
So it is still morning. So good morning. Suprabhat. आप लोगों ने एक्सटेंसिव मैटेरिया मेडिका का मेथोडोलॉजी देखा. अभी देखो, मैटेरिया मेडिका इज अ वेरी वास्ट सब्जेक्ट. Many of the authors have said it is sea. And if you want to travel in a sea, you need a radar. You need some device to understand where you are going. तो वही रिलेशनशिप है मैटेरिया मेडिका का और रेपर्टरी का. And repertory has come from materia medica. So we can say it's a mother and child relationship. Mother materia medica है और child है repertory. Which is more precious? The child. चाइल्ड इज द फ्यूचर, है ना? आप मदर से ही पूछ लो विच इज मोर प्रेशस, तो यू आर गोइंग टू गेट समथिंग विच लुक्स नाइस, which looks attractive, which is promising in the future, and which is going to lead the whole generation. We say child is the father of nation. Child means repertory. Mother is maternity. So repertory is the future of homeopathy. And without knowing repertory, you cannot practice homeopathy. आज इतने क्वेश्चन आ रहे हैं ना, होम्योपैथी क्या है, होम्योपैथी प्लेसिबो है, लेकिन अगर हम रेपर्टरी का यूज़ करें तो ऑटोमेटिकली एवरीथिंग इज डॉक्यूमेंटेड, एवरीथिंग इज बेस्ड ऑन एविडेंस, एंड दैट इज व्हाट वी रिक्वायर्ड. सो व्हेन यू प्रैक्टिस रेपर्टरी, यू प्रैक्टिस होम्योपैथी इन अ वेरी साइंटिफिक वे. लेकिन ये इतने जो रिजल्ट आ रहे हैं होम्योपैथी में, कैसे आ रहे हैं, क्यों नहीं सबको आ रहे हैं, क्यों कोई फेल्योर है, वाई सम पीपल आर सो मच सक्सेसफुल? बिकॉज दे हैव फॉलोड ए मेथड. देखो, एक आपको ऊपर जाना है तो सीढ़ियों का तो यूज़ करना ही पड़ेगा ना. अगर आप सीधे जंप लगाएं तो गिर भी सकते हैं. तो दीज आर स्टेप्स. रेपर्टराइजेशन गिव्स यू ए कॉन्क्रीट मेथडोलॉजी, और इसके लिए आपको जानना चाहिए कि क्या है रेपर्टरी. ये हवा नहीं है. रेपर्टरी इज़ नॉट समथिंग बिग. वो बुक देखते हैं ना इतना मोटा मोटा, तो लोग डर जाते हैं, अरे इतना बड़ा पढ़ना पड़ेगा. एक हमारे पेशेंट आती है बच्चे को लेकर, और हमारे पास मर्फी रेपर्टरी इतनी रेड जो बुक है ना, लास्ट एडिशन, वो पढ़ी है. तो बोलती है इतना आप लोगों को पढ़ना पड़ता है क्या, इतनी मोटी बुक है. हम बोले इसमें से सब और सब टाइम नहीं पढ़ना पड़ता, कभी कभी कोई कोई चीज़ रेफरेंस के लिए रखते हैं. तो ये ऐसी चीज़ है कि दिखती तो बहुत बड़ी है, लेकिन इतना सरल है, इतना इंटरेस्टिंग है कि एक बार इसमें आप घुस जाओ तो आई कैन टेल यू रेपर्टरी विल बिकम योर डे टू डे फ्रेंड. और आप घूमते हो ना लाइब्रेरी में, आप उस तरफ नहीं जाते हो, हम जानते हैं, जिधर की रेपर्टरी की मोटी मोटी पुस्तकें रखी है, वो तो हाथ जोड़ के खड़ी है ना, आ जाओ हम इधर हैं, आप इधर घूम जाते हो. सो रेपर्टरीज आर द बेस्ट फ्रेंड. लेट मी कम टू द सब्जेक्ट. बिफोर दैट आई विल टेल यू वन स्मॉल थिंग. व्हेन एडमंड हिलारी केम टू इंडिया at the 50th celebration of his conquer of Everest, उनसे यही पूछा गया कि आप एवरेस्ट पर विजय कैसे प्राप्त किए, क्योंकि बहुत सी टीमें जाती हैं, लौट आती थी, मर जाती थी, किसी का पता नहीं चलता था. उन्होंने कहा वो हमको याद है, बहुत फ्रेंडली, एंड ही सेड दैट बी फ्रेंडली टू समवन और समथिंग विच यू वांट टू कॉन्कर. अगर आप माउंटेन को फ्रेंडली बना लो तो माउंटेन टेल्स यू अब तूफान आने वाला है, सजग हो जाओ, बारिश आने वाली है, सजग हो जाओ. एंड वी वेंट फ्रेंडली विद द माउंटेन. तो अगर पुस्तक को जीतना है, फ्रेंड बना लो. रेपर्टरी को विन करना है, उसको फ्रेंड बना लो. डेली इसको देखते रहो, बातचीत करते रहो, आपको हमेशा सपोर्ट करेगी. सो वांट टू विन होम्योपैथी, वांट टू विन रेपर्टरी, डोंट गो अवे फ्रॉम देम, मेक इट फ्रेंडली, एंड यू सी हाउ रेपर्टरी इज गोइंग टू हेल्प यू. ये है. We will talk something about theory of repertory, which is a very important thing. Unless you know the theory, you can't go to practicals. And you can have big, difficult type of cases cured if you know the basic theory of things. Because to be more practical is just to stick on to theory, nothing else. और दो बिंदु के बीच में एक ही लकीर आती है. The truth is only one. So repertorization is what you must know. थोड़ा सा introduction भी हो जाए. The aim of day-to-day practice is to cure which is possible. Only if physician is able to select the most similar medicine or similimum for the sick. Cure तभी possible है जब आप similimum का select कर सकें. Otherwise, even a case of cough is incurable. लेकिन even a cancer is curable when the things are very clear to you and you can select a similimum. केट ने एक जगह लिखा है why cancer is not curable. देखो हेडिंग कैसा है. Why cancer is not curable. उन्होंने लिखा है कि because there are a lot of pathological symptoms and we do not have the clear picture which can help you to select similimum. So only palliation is possible. Since the system is based on nature's law of cure, अच्छा ये है ना. किधर जाते हैं? Somebody can help. ये थोड़ा हेल्प करो. Since the system is based on nature's law of cure, similia similibus curanter, a physician arrives at totality of the patient first and then search for similar picture in our materia medica to find a remedy which is matching to the disease and the sick on the basis of similarity. तो दो चीज़ है. You have to find out totality of the patient and search the similar picture in materia medica. ये आप कैसे करेंगे? ये repertory से भी possible है and knowledge of materia medica से भी possible है. Repertorization is a means which helps to search and suggest the right remedy or a small group of similar medicines. Totality of symptom is considered as the basis of repertorization. ये याद रखना. Totality of symptom is considered as basis of repertorization. What our stalwarts told about therapeutic way of clinical practice, Organon बोलता है, from this indubitable means which cannot be doubted, that beside the totality of symptom, nothing can be any means be discovered in the disease wherewith they could express their need of aid. It follows undeniably that sum of all symptoms is each individual case of disease must be sole indication, the sole guide to direct us in the choice of remedy. What is special in homeopathic prescription? It does not merely depend on diagnosis of disease, but it also takes into account the understanding of the person that is sick. Expression at mental and physical plane are taken into account. Totality of symptom becomes the basis of prescription. Understanding the totality will lead to the portrait of disease. This portrait has to be matched with the image of medicine. We study the medicines in materia medica from the point of understanding the image. It needs a skill to create a disease picture and drug picture in case taking and the study of materia medica respectively. तो हम पढ़ते तो हैं materia medica, लेकिन उसका इम्पॉर्टेंस समझिए कि हाउ टू मेक द पिक्चर इन योर माइंड. अभी जैसे मान लीजिए एकोनाइट का पिक्चर अपने माइंड में है, उस तरह का पिक्चर आप खोजना है सिक में. कोलोसिंथ का है, लाइकोपोडियम का है. तो ये इमेज जो है, कभी कभी इतने ज़्यादा सिम्टम आ जाते हैं कि इट बिकम्स डिफिकल्ट फॉर अस टू रिमेंबर द इमेज. सो वी टेक हेल्प ऑफ repertory. We take help of some device that is repertory. In other sense, a physician needs to have art of knowing the patient and knowing the medicine in totality. Therefore, obligatory in homeopathy prescribing to learn and master the art of prescribing. So there are only two things required for you. to understand the picture of patient and understand the picture of medicine. Aim of physician in prescribing should be to look for a medicine which is as closely similar to the picture of sick as possible, to match the portrait of disease to the match of medicine. तो बोगर ने कहा है कि वी आर सिंपली वर्किंग एज ए मैच मेकर. मैच मेकर आजकल बहुत फेमस होते हैं. तो वी आर ऑल्सो functioning as a matchmaker between patient and between the materia medica medicines. Here the role of repertorization becomes very important, crucial and obligatory. What is repertory and see this I have prepared keeping in the mind that there are students, there are practitioners and there are teachers. This will be useful in a very simple language for all three who are sitting here. So repertory is useful and practical discipline in homeopathic system of medicine. This deals with the indexing of the whole content of homeopathic materia medica in a very systematic and logical way based on some definite principle so that the finding of needed symptom in the sea of materia medica becomes easy and prompt. तो स्टूडेंट्स के लिए कितना इजी है, ये क्या है, एक सिस्टमेटिक अरेंजमेंट है जहाँ की सिम्टम्स हैं और मेडिसिन्स हैं. तो जब भी ज़रूरत पड़े हमको मिल जाए उस तरह की इसमें फैसिलिटीज़ अवेलेबल है. तो ये बहुत हेल्पफुल सब्जेक्ट है, एक हेल्पफुल इंस्ट्रूमेंट है, यू कैन से. In between I'll take some water because I have some problem. So homeopathic repertory is defined as a systematically, logically arranged index to homeopathic materia medica, which is full of information collected from toxicology, drug proving, clinical experience. So just now you have heard the sources of materia medica. वो इतने सोर्सेज हैं, इतने वास्ट मटेरियल है. जैसे कि आप देख लो हेरिंग गाइडिंग सिम्टम, सल्फर देख लो, कैलकेरिया काफ देख लो. इफ़ यू हैव सीन इट, हाउ मेनी ऑफ यू हैव सीन सल्फर इन हेरिंग्स materia medica? 4-5 हज़ार सिम्टम है. एक एक मेडिसिन के इतने सिम्टम हैं, तो अगर आप एक मेडिसिन पढ़ोगे तो लगेगा कि सब सिम्टम इसी में है, वही मेडिसिन पढ़ते रह जाओगे, वही मेडिसिन प्रिस्क्राइब करोगे. लेकिन अगर उसका जिस्ट समझो, इमेज समझो, कैरेक्टरिस्टिक समझो, तो उसको समझने के लिए रेपर्टरी ज़रूरी है. सेक्शन वाइज, कैरेक्टरिस्टिक वाइज इट इज़ अरेंज प्रॉपरली. So why repertory is so important? It's a practical device to help a physician to find the symptoms and thus match the totality of patient to finally get the minimum. And what Kent is telling you, the use of repertory in homeopathy practice is necessity. If one is to do careful work, our materia medica is so cumbersome without a repertory that best prescriber must meet with only indifferent result. अभी हमारे जितने prescriptions हैं आप लोग देखते होंगे. See, once I was presenting a case in Tripura. There was one question, very genuine question. वो पूछा कि एक केस को अगर 2 होम्योपैथिक डॉक्टर को दे दिया जाए, 3 को दे दिया जाए, so there will be 3 separate prescriptions. Why that happens? आपने सल्फर पढ़ा, एक हम लोग ओपीडी में रहते थे कलकत्ता होम्योपैथिक में, तो एक हमारा टीचर जो था वो 4-5 लोगों को सल्फर दे दिया. तो हम लोग आपस में बात कर रहे थे कि टुडे सर हैज़ रेड सल्फर इन द मॉर्निंग परहैप्स. ऐसा होता है कि आप materia medica पढ़े हो, वो सिम्टम क्लियर है तो लगता है कि वही पेशेंट है. अच्छा, ये 2-3 फिजिशियन क्यों डिफर करते हैं? उनका देखने का एंगल अलग होता है. लेकिन होम्योपैथिक प्रेस्क्रिप्शन शुड बी बेस्ड ऑन स्ट्रिक्ट प्रिंसिपल, तो ऐसा नहीं होगा। अगर वो भी एनालाइज करें केस को, वो भी इवेलुएट करें केस को, वो भी अंडरस्टैंड करें कि कौन सा सिम्टम इम्पॉर्टेंट है और किस पर प्रिस्क्रिप्शन देना है, तो ऐसा नहीं होगा। सो इफ़ योर प्रिस्क्रिप्शन इज बेस्ड ऑन साउंड फिलोसॉफी, टोटालिटी एंड कैरेक्टरिस्टिक, दिस डिफरेंसेस शुड नॉट कम। आ रहा है तो ये हमारी कमी है कि इस केस को हम समझ नहीं पाए फ्रॉम द स्ट्रिक्ट होम्योपैथिक पॉइंट ऑफ व्यू। तो ऐसा नहीं होना चाहिए। तो क्यों नहीं होना चाहिए और कैसे नहीं होना चाहिए? बेस योर इवेल्युएशन एंड रिपोर्टराइजेशन ऑन स्ट्रिक्ट प्रिंसिपल, तभी ऐसा हो सकता है। अच्छा, हनुमान का एफोरिज्म 153 आपने पढ़ा है, उन्होंने ये बताया है कि what are the important symptoms and what are the not important. I'm not going to explain that. But what he has said is, the more general and undefined symptoms like loss of appetite. अब कोई patient आता है, fever है, headache है, and he is telling you, I have got loss of appetite, I have got debility, I have got restless sleep. These are all very common symptoms. There is nothing characteristic in that. तो इसका importance आप मत दो. Only characteristic symptoms should be given importance. That is what Hahnemann is telling. Boninghausen is telling, no, he is writing in the aphorism note that Boninghausen book is very important. This is the first time he has given reference in organon that repertory is very important. कभी कभी क्वेश्चन पूछते हैं आपके एग्जामिनर कि वेयर इट इज रिटन बाय हानेमन दैट रेपर्टरी इज इंपॉर्टेंट, व्हाट इज द रेफरेंस गिवन इन ऑर्गेनन. सो दिस इज द फुट नोट ऑफ 153 एफोरिज्म. So Boninghausen has said that it is expedient and it helps you to prescribe. Kant's view, the success of prescribing depends on the views taken of totality of the symptoms. The view of any given totality affords the indifferent and the marked success in any given case. To be able to view the totality of symptoms so that most similar remedy will appear to the mind is aim of healing artist. So the gist is he is giving importance to the totality. And see what importance he is giving to pathological symptom. The pathology, ultimate symptom are of least value. But a physician must have a good and full knowledge of all these, as well as of anatomy and physiology, or he will not have the basis for good judgment, and hence he will form a distorted view of totality. So, study of anatomy, study of pathology is important, but for what? अभी आप फीवर सिम्टम जानते हैं, डिहाइड्रेशन होता है, थर्स्ट इंक्रीज्ड होता है. So in a case of fever, thirst is a common symptom. In case of migraine, vomiting is common symptoms. So if your prescription is based on that symptom, then you will not have the correct characteristics. So to know the common symptoms, you should know the pathology, you should know the anatomy. अब जैसे एक case of gall bladder, stone, pain in the right hypochondrium, this is a common symptom. But what increases, what decreases, what are the concomitants, that should be guide for you, not just the pain at right hypochondrium. So to have an understanding of what is characteristic symptom, this is important. And Boger is telling, correct prescribing is the art of careful fitting pathogenetic symptom to clinical symptoms. And then he gives importance to the knowledge of mathematics as knowledge of repertory. Now, Kant is telling when you should read the repertory. Physician must study homeopathic principle until he learns what is in sickness that guides to curative remedy. So Kant is telling first study the organon. to know what is homeopathy, what is the principle. Then he must study materia medica until he learns what is needed to meet these demands. Then he must study repertory until he learns how to use it so that he can find what he wants when he needs it. And these are the stalwarts for repertory. See, he started with the Hahnemann. He is the father of repertory. I mean, he is the person who gave the idea. Then first person was Bonning-Herschel, who did it. His disciples, some other disciples could not do that. Then you have Kent, Boger, and Clark, and as well as your concordance repertory. Now, see, we are coming to the conclusion of theory part. In a case, what should you look for prescription? Is it the beautiful pathology? Is it the beautiful description of the person? No, you have taken the case, and in that you have to find out the modalities. Find out in whole case what are the modalities which are important. Aggravating factor and ameliorating factor. Causation, time, temperature, weather, and other things. And all uncommon symptoms in the person. Symptoms belonging to the whole person, mental and physical. That means general symptoms. Then comes pathological generals, that is common tendency and concomitant. So ye aap analyze karo, the whole case is taken, and then you will understand these are the important things. Base your prescription on this. And some types we have keynote prescriptions. Now, what are the types of cases we are getting in our practice? We get acute cases and we get chronic cases. You can divide the whole cases into two as per organelle, as per our master's understanding. Acute cases, we'll come to that. Chronic cases can be with characteristic symptoms and can be with dominant pathology, with concomitants, or can be just no characteristics. आप अगर पूरा अपना केस देखें तो you can divide all cases which are coming to you into all these categories. या तो acute case आते हैं या chronic case आते हैं with all this. And what is the method we have? We have repertorial and non-repertorial. Repertorial में we have Bonning-Herschel method, Boger method, Kent's method, and clinical method. Non-repertorial में we have a picture method in our mind with the knowledge of materia medica or with your experience. If it is repertorial, what are the steps you have to follow? See, nowadays we are seeing our new syllabus, and it is CBDC, competence-based dynamic curriculum. The repertory is competence-based is on these steps. First step is case taking. If you are competent in case taking, then you go ahead to the next, defining the problem, understanding the disease, then analysis, totality, selection of repertory, repertorial result, and analysis of the result. So earlier also there was CBDC. Only we were not understanding at each stage we have to evaluate ourselves. We have to evaluate our cases. Like first thing is case taking. Case taking क्या करते हैं हम? See, we think that case taking is the most easy part. ऐसा नहीं होता. Case taking is the very difficult part. And once we say that once case is well taken, it is half cured. Elizabeth Wright has said. Why she has said? कभी देखा है आपने हाफ केस ले लिया, फुल केस ले लिया, हाफ क्योर हो गया? ऐसा देखा है? ऐसा होता है कि ये पूरा केस ले लिया, जाओ आप तो हाफ क्योर हो गए? ऐसा नहीं होता है। बट कहा क्यों गया ऐसा? तो केस टेकिंग आई थिंक इज द मोस्ट डिफिकल्ट। और इसलिए भी कि हम केस टेकिंग, चलो कुछ सिम्टम ले लेते हैं। अभी आप एक इंटर्न को केस टेकिंग के लिए भेज दो, वो एक पेज में लेके आ जाता है, बोलता है सर इसका ये तकलीफ है। बट वेयर इज द पिक्चर ऑफ डिजीज? वेयर इज द केस? एक बार केंट ने ऐसा डिस्क्राइब किया अपने फिलोसॉफी बुक में कि उसका एक स्टूडेंट 30 पेजेस का केस लाया, तो उसने कहा कि वेयर इज द केस? दीज आर द सिम्टम्स, देयर इज नो केस इन दिस। सो केस क्या है जिसके लिए हम खोज रहे हैं, मिल नहीं रहा है? हम एक अपना पर्सनल एक्सपीरियंस बताएंगे। एक बार डॉक्टर एमिल धावले, आपने नाम सुना है? I was sitting with Emil Dhavle. He used to come to Father Muller's to guide us. तो एक केस था, it was a case of rheumatoid arthritis, well diagnosed. And the lady was a psychologist. तो हम लोगों ने उसको बोला कि आप अपना केस हिस्ट्री ले लो, खुद लिख के ले आओ। और हम लोगों ने कुछ हेडिंग्स बनाया था, एक केस हिस्ट्री राइटिंग फॉर्म। उसने 20 पेजेस केस हिस्ट्री लिखा। एक दिन पहले सबमिट करना पड़ता था, और फिर जिसको केस लेना है उसको वो केस रिटन हिस्ट्री दिया जाता था। सो आई हैव रिटन दैट केस। और उसमें क्या क्या पूछना है, यू हैव टू मेक ए इंटरव्यू प्लान। दैट वाज द टाइप ऑफ ट्रेनिंग एमिल धावले यूज्ड टू गिव। सो बिकॉज एवरीथिंग वाज रिटन, देयर वाज नो अदर थिंग्स टू आस्क। तो हमने कहा धावले साहब इसमें तो सब कुछ है, वी कैन ओनली आस्क फ्यू क्वेश्चन, व्हाट आर दोज फ्यू क्वेश्चंस? तो बोले कि ओके यू वेट, यू सिट इन द साइड एंड आई एम टेकिंग द केस। सो डॉक्टर धावले sat in front of that patient who was sitting, and he was telling that Dr. Dhawale's one principle was speak less, let patient speak more. Then he sat in front of the patient और ऐसे चश्मा उतारा and looked into the patient's eye, and he said, it gives me impression that you are not happy. Silence. The patient was also not talking, he was also not talking. I was a little restless. It continued for more than 30-40 seconds. Then suddenly patient burst out, started crying. Yes, doctor, I am not happy. And she told at least half an hour her story and cried so much. The whole case taking was over with one question, and we went for physical examination. So the case taking is a very crucial phenomenon. It gives understanding everything about the patient. So don't neglect that process. वो आपको ये बता देगा कि ये पेशेंट क्या है, डिजीज़ क्या है, आप क्या देंगे, क्या मेथड फॉलो करेंगे, कौन सी रेपर्टरी आएगी, सब कुछ केस टेकिंग ही आपको बता देगा। So give importance to case taking. Spend some time with the patient. हरी बरी में नहीं। लेकिन ये भी बात है कि आपके मान लीजिए बहुत से पेशेंट हैं। ये बहुत से पेशेंट कब होते हैं? जब आप कुछ स्टेज क्रॉस कर लेते हैं, तब आप यू डोंट रिक्वायर दैट टाइम सो मच, बिकॉज यू अंडरस्टैंड एज सुन एज द पेशेंट इंटरेस्ट यू अंडरस्टैंड। लेकिन तब तक तो आपको मेहनत करना पड़ेगा। सो केस टेकिंग इज़ वेरी इंपॉर्टेंट, and all the steps, if you follow all the steps properly, you will achieve success. And if not, say that homeopathy is difficult, but you will not have that opportunity. It will give you always good result. So this, I am not going to discuss much about what is case. Case taking is complete analytical systematic examination and Hahnemann calls it individualized examination in aphorism 82. P.P. Wells tell, it took me 30 years to learn how to examine a case. But don't be frightened. You learn from the other's experience. Then comes defining the problem. After case taking is over, you should know what is the problem patient is facing. So problem definition includes what? Disease diagnosis, diagnosis of the person, who is sick, and what is his problem, nature and progress of disease. The whole phenomena of the disease and patient is clear to you. You know, once the problem is defined well, resolution comes automatically. Analysis, देखिए analysis very simple process है. After case taking is over, divide whole symptomatology into two things, common and uncommon. For you, uncommon is very important, and disease diagnosis, common is important. And uncommon you can divide into general and particulars. Arrange symptoms as per hierarchy and their importance, following a specific philosophy and methodology. Kent has one type of hierarchy, Bonninghausen has another, Boger has another. The case will tell you which method to be followed. Case taking study करने के लिए following things you may refer: Hahnemann's Organ of Medicine, Bonninghausen Lesser Writing, C.M. Boger's Studies in Philosophy, J.T. Kent's Philosophy book, Roberts' There is a Taking of the Case, Stuart Close Examination of the Patient, Emil Davale Receiving the Case, and in my book also there is one section on case taking. Now this question is very often asked. Is repertorization necessary in all cases? What is the answer? Yes, but the kind of repertorization differs. One is mental repertorization, done in each case for a homeopathic prescription, done by experienced practicing physician. Knowledge of comparative materia medica is must. अब आप केस ले रहे हो तो पूछते हो what do you like? Salt. You are hot patient, chilly patient, sun aggravation. Automatically your symptomatology is going to end with a conclusion. तो वो mental representation logical already आ रहा है. Then comes referential method. You just refer few symptoms which you do not know and compare yourself. And third is systematic repertorization done following some definite steps. Decide need of repertory, whether this case needs systematic repertorization. This you can decide after the case taking. Which repertory is required also you have to. Which repertory means which method. Like if the case has cause-effect phenomena, pathological generals, or modalities and concomitant, then you can go for Boger's method. If the case has qualified mentals, physical generals, characteristic particular, then Kent repertory is automatically coming. If the case has complete symptom, therapeutic pocket book should be best choice. If the case has no characteristic and only common symptoms, then you can go for clinical repertories. So is it clear? The case is taken, analysis is done, and then you can go for selection of repertory. Then we go for acute cases. One case I am going to present you, the case of interception. This is a diagnosed case of interception reported with a severe abdominal pain. The pain was violent, used to come and go suddenly. Patient was brought from homeopathy treatment because he was advised hospitalization, observation, and surgery. So for that reason, they came for homeopathic treatment because they were known family who were taking homeopathic medicines. And the history is pain started suddenly at 3 a.m. He was given buttermilk, which relieved the pain a little, but pain continued. Morning he was taken to the medical checkup, nearby physician, and he suspected some worm and gave some medicine, but then he was not better, he was admitted to hospital. And he was taken for ultrasonography. In ultrasonography it came as intersusception. And there is one ASA hospital in Mangalore, he was taken to there. They brought the paper. They brought everything and came to homeopathic treatment. This is ultrasound. Here there is a report saying intersusception. On further inquiry, the following symptoms were found. Now just see carefully what are the symptoms available to you and what you can do, whether you should take up the case, because sometimes intersusception cases are very serious. The child was very irritable with the pain. Anger used to increase the pain. Pain was better by pressure. Child was lying on abdomen. Passing of his stool relieves the pain. Hunger not reduced. He was asking for frequent food. Reference method we have done. Irritable with the pain, we have Bryonia, Chamomilla, Colocynth, Coffea, Nux vomica. Anger increases pain, Bryonia, Chamomilla, Colocynth. Abdominal pain, pressure ameliorates, Colocynth, Macphos. So all these rubrics we have taken. You see, one medicine is common in all. What is that medicine? Colocynth. Group of medicine to be considered because of the prominent modalities, because he has come like this. What happened? Something gone wrong? Go for presentation mode. Somebody is taking care of this presentation. Computer. Okay. So because of the prominent modality, he was prescribed Colocynth. Slowly the severity of pain subsided, and next 12 hours the pain stopped. After the pain subsided, he was prescribed a deep acting remedy, completely cure and prevent the further recurrence. And what was the deep acting remedy? Child is thin built, liable to get digestive troubles, had problems during dentition, sweat on the head profusely, weather changes causes cold and tonsillitis, craving for meat, chilly patient. So he was given calcarea phos. Overall he felt better, and then he was sent for ultrasonography. And that shows everything is normal. Generally, appendicitis cases, we are very afraid. But I have a series of 6-7 cases of appendicitis which came to us, and we have given me relief. Now see, this is one of the case. 5 years old came for the treatment of diagnosed case of, and they come with the diagnosis. He was treated by local measures of stomach pain initially. Then he was admitted to ICU for pain. He had severe pain, and then he was admitted, not knowing that he has appendicitis. When the pain, especially the vomiting, was a little better, he was referred for surgery, to which patient did not agree and wanted homeopathic treatment. See the report. Right iliac fossa suggestive of appendicitis. And these are the information: hot patient, moderately built, takes water often, dryness of the mouth, craving for peda, hot jalebi and egg, cannot tolerate small corrections, and he always says, I am right. Irregularities, food habits causes problem. Pain better by hot application. Right iliac fossa. He was given lycopodium 0/1, and then The patient became better, and then ultrasound shows that he is all right. No sonological abnormality detected. So the cases of appendicitis also, we have very good medicines. Only thing is you should go on totality and right methodology. This is one case which really needs you to think over that. Read it. Can you give me some water? Water. At this stage, I will tell one of my conclusion is, even congenital anomalies can be cured if it is brought to you during gestation time. If a lady is pregnant, we have seen even VSD, clubfoot deformities, and some of intrauterine problems can be dealt successfully with our medicines. So we are very advanced in treatment in intrauterine period, even if it is congenital problems. I have some cases like that, but I have brought only 1 or 2 cases of this type of where we have treated intrauterine problems. This is one you see. Patient has come 28 years, 5 weeks and 5 days gestation with yolk sac without embryo and no cardiac activities. She was advised to abort the dead embryo. They said, it is a dead embryo, go for this. She approached to inquire whether any treatment is available in homeopathy. She was very tensed because she had abortion 6 to 7 weeks pregnancy last year also. And this time also obstetrician has told to go for DNC, but can wait for a few days. Then she sought for homeopathic medicines. And this is the ultrasound you see. Single intrauterine gestation sac corresponds to 5 weeks. But what is written up? No embryo seen, yolk sac seen, no cardiac activity visualized. So only gestational sac is there. Then I thought whether it is common or there should be any cardiac activity as 5th week. So I referred some books. And what the book is telling, usually in a healthy fetus, the heart rate increases from 110 at 5th week of gestation to 170 at 9th week of gestation. From then on, there is gradual reduction in heart rate that reaches a mean value of 150 at 13th week. So now what picture we have? Very less characteristics. She had frequent desire to pass urine, that is one, with only passing of a few drops. Urine is scanty and colored and thirstlessness. And next is abortion at early pregnancy. She had a history of abortion early pregnancy and above symptoms. So we referred Kent's repertory. See there, abortion early pregnancy, there is a rubric. So that group of medicines, with the help of frequent desire to pass urine, thirstlessness, and urine is scanty, we got a medicine that is epismel. Epismel also has tendency for early abortion. So because dead fetus, I could not get a rubric, and there cannot be because dead things we can't treat. So she was given epismel 34 pills morning, empty stomach, daily. See, this we have given because there is a possibility of structural damage and we cannot give high potency and 1 or single doses. After completing 10 days, she was asked to come with a repeat ultrasound. What is saying? Go close. No. See here what it says. Single viable intrauterine pregnancy correspond to 7 weeks, and up you see cardiac activity is visualized, fetal heart rate 137. See, this was possible because of your reference and knowledge of materia medica as well as repertoire. One more case. Yesterday only this case has told me in the WhatsApp, and I took the help of one of the student, Viraj, who came for taking the copy. I said, include this case also. See, this is a case. You can see this is from Gujarat only. One ultrasound was taken because the person was working in Gujarat. They are from UP actually. And here, I could not do good picturization. It's a ectopic pregnancy. Can you read from there? I don't know. Ectopic pregnancy is the finding in this. And then they were advised, go for operation, remove it. They contacted me. I said, ectopic pregnancy, we can't do anything. But you can wait for some time. They said, we want to go to our village, and there only we'll do operation, because here nobody is there, only husband, wife, parents were at home. I said, okay. I said, any peculiarity do you notice in that lady? What they said is, she's not eating anything, eating little also sometimes, but not talking to anybody. She has aversion to all the persons. And husband was very close, she has aversion to the husband also. So this is very important change noticed in that lady. She doesn't want to talk to her mother also over the phone, nor that she wants to talk to the husband, nor to her brother. A very peculiar change. She was a very, very, you can say, very healthy, smiling lady. So this change was there. I said, till you reach your village, take 1 dose of CPR 30. Aversion to meet all people. This reference is there under mind, aversion to all people. CPR is the single medicine. And this was the result of, sonography, ectopic pregnancy. And then I said, before you go for operation, go to a gynecologist and do one more ultrasound. To our surprise, you see, this pregnancy of ectopic has become a normal pregnancy. But still, no heartbeat, like the last case. Can you see the I can read because this has come yesterday only. In my mobile it was there. These reports were there, only the last report has come early. Evidence of gestational sake, and no heart and no fetal pole is noticed. Viraj, you should have done little better work, I think. Should have cut and paste separately. So this was the condition. So I was very happy that at least one stage is, difficulty is gone. Ectopic pregnancy has become a normal pregnancy, but still there is no heart sound. But because of my experience earlier, I thought this can be taken care. So I asked, what are the symptoms? Because, see, we can't give EPIs again because we had one case cured. This is called prejudiceness, which Hahnemann has always warned. One case success with one medicine, don't think that medicine has become specific to all disease. See the indication. I asked them, what is any symptoms? She said, no, there is no symptom. But she is very, feels that her body is fully relaxed, there is no strength. Then I referred a synthetic report that was in my mobile. Synthetic report, there is a rubric, fetal growth arrested, sickle carb, single remedy. I was not happy. I referred Murphy report. There are 3-4 medicines are there, but sickle carb also is there. Then I gave sickle carb. And I was afraid to give sickle carb because people say it removes retained placenta, it causes, something to discharge. Anything in the uterus it can take out. So I said, okay, there are no other indication, give sickle carb. And then I asked, after 15 days, which was yesterday, take the ultrasound. So they took and they sent me on the WhatsApp. Here, single alive intrauterine gestation and fetal cardiac activity is present. Cardiac pulsations are well recorded. Fetal heart rate is 143. So this is a miracle which homeopathy only can do. Because see, somewhere where nobody has assessed, nobody can think also, like the case which was presented by Praveen also. Uterus not present. I have also treated one case of hypostatic uterus, small uterus. She became pregnant. But I was surprised to see uterus was not present. Ovaries were not present. And it became, it led to the growth to a lady, and lady became a mother. So can you think of such a type of cases in any other system of medicine other than in God's blessing? Can be possible only by homeopathy. And it's very unfortunate that some of our youngsters think that homeopathy is inferior science. Some of our next generation think that attractive is allopathy. Attractive may be, but genuine is homeopathy. And those who practice homeopathy, those who had taste of homeopathy, they cannot go to allopathy, I will tell you. So practice what you have, and what treasure you have, you can't imagine. There was one atomic Baba Research Institute scientist. He said that homeopaths are sitting on a golden treasure, and they do not know. They want others to find out that there is a gold inside. So you are the best profession, but it needs hard work. How some have become a good homeopath? Because of their sincerity. ये होता है ना, मुन्ना भाई लगे रहोगे तो मिलेगा. कबीर दास ने कहा था ना एक बार, जिन डोणा तिन पाया गहरे पानी पैठ, मैं बापुरा बुढ़न डरा रहा किनारे बैठ. तो किनारे पे रहने से मोती नहीं मिलती है. आगे बढ़ो, बहुत से अच्छे एग्जाम्पल्स हैं.
सर
2 मिनट और ले लो. 2 मिनट. आई विल कंक्लूड. So repertory is that valuable. See the reference method, repertorization systematic method, and your mental repertorization is always there with you. So repertory is always with you. Without repertorization, there cannot be a homeopathic prescription, because repertorization is based on totality. Without totality, there cannot be homeopathy. ऐसा नहीं है कि डिजीज का नाम दिया, आपने मेडिसिन दे दिया. वो तो इक्का दुक्का लग जाता है. लेकिन सिस्टमेटिकली इफ यू वांट टू प्रैक्टिस, Repertorization is must. फीवर केसेस यू हैव फीवर टोटालिटी, उसमें चिल के, हीट के और स्वेटिंग के, टाइम, टाइप, एग्रावेशन, एम्बुलेशन, concomitant if you have, you can treat any case of fever. And fever as the primary things nowadays. If you can't treat a case of fever, you can catch the whole family, and the whole family becomes your patient. Chronic cases तो हमने बताया नहीं आपको, लेकिन इसमें भी बहुत सक्सेसफुल चीज़ें हैं. एक ओवेरियन सिस्ट का है. We have followed Kent's method because there were a lot of mental symptoms. So everything depends on your case. Case decides you which method you have. If you have more of mental characteristics, go for Kent. If you have location sensation, go for Bonning-Husson method. So after case taking, this was the analysis. Common symptoms and uncommon symptoms. Your totality becomes important for the uncommon symptoms. And then evaluation you find. First rubric is complaints caused by grief. So like this was the totality. And this patient was given lachesis, and ovarian cyst became less after 1 month. Second, third follow again became less, and then it disappeared. So you go systematically, things will happen. Then a case of rheumatoid arthritis. Within 2 months, this rheumatoid arthritis case was cured. The reports were normal, symptoms were normal. See the RF factor, ESR, it was high. This was followed. See, every step you have to be carefully done, and then you will be clear at the end which method is going to help you. Here, BBCR method is done. And silesia was given. Reports were normal, and patient became all right. Then again ovarian cyst.
Slow, sir, slow, slow.
One case I wanted to show you. Location, sensation, modalities, concomitant method. This is the most easy method you can say. See, any patient coming to you, your location will be always clear. He only tells. Complaints will be clear. You have to find out modalities and few concomitants. If these 4 things you can find out in any case, you can treat that case. The easiest method is Bonning-Husson's method. Here I am telling you a case which was a Malayalam patient, and I don't know much Malayalam. So patient has brought the report, and few symptoms he has told. So this is just to tell you that sometimes without much data also, if location, sensation, modalities are clear, you can treat a case. See what happens. Patient has come with a big fibroid. The report is 160 into 94, 104 to 94 millimeter. This is the fibroid. Then patient was taken the case, but not much is available. There is not much time, so we are not going to discuss. So what we have taken is location, we have taken sensation and concomitants. And patient was given calcarea cup 30. The second report after 1 month it has come 98 into 84. 1/4 was less. Third report, still it has come less. She went to Gulf since her husband was working in Gulf. She continued with the medicine. She came with her father, who had multiple warts around the neck. He was asked about the warts. He said his brother and father too has warts and not going out because in spite of homeopathic medicines. The patient, his daughter was given Tuza once a week as intercurrent medicine. Her constitutional medicine, Calcarea carb, was continued. After 3 months, sent a message that she was pregnant as she wanted to go for obstetrics for further care. So, what I am telling is, here one more concept is there. People come with the report and ask, see, I have got fibroid. Can I become pregnant? Yes. Our answer should be yes, because uterus has that capacity. I have few cases which are having fibroid also, and they conceived and they delivered also properly. This was one of the cases. So fibroid is no doubt obstruction sometimes, but it is not that it is impossible. If implantation is there at the proper place, it can give you good result. And our medicines are able to do that. They are intelligent, you know. They know where to do implantation, where to reduce the size. One case I remember where fibroid was so big that the baby was not able to grow. So after giving the medicine, what happened? Fibroid became less and baby's weight increased. So that can happen in homeopathy. So it's all because of repertorization and following the strict principle. Every homeopathic physician should expertise himself in art of prescribing by emphasizing on repertorization. This is the only right way of therapeutics. Art of prescribing is learned by applying the principles into practice without violating norms with the knowledge of disease. Follow the guidelines given by our stalwarts. There is no shortcut in learning, especially when it comes to learning of practice of medicine. Whether it is repertorial or non-repertorial, mechanical similarity will lead to failure. Remember, don't try to make mechanical similarity. What exactly is the characteristic? Take care and find your medicine only on the basis of characteristics. Repertorization done properly leads to constitutional, miasmatic, and all kinds of prescription depending on the totality. The need for repertory comes from the character of homeopathy itself. Homeopathy is a logical science. Repertorization is a logical steps. So the character of homeopathy tells you that repertorization is must. There is a need and must be truthfully said an urgent demand for a repertory which will enable the physician to find quickly, certainly, desired symptoms in materia medica together with indicated remedy. The last one, the proper use of repertory is indispensable to prescriber, especially in complicated and difficult chronic cases. So all chronic cases require repertorization because it will create a good document also. The materia medica is so vast that it is not possible to carry it all in memory, nor it is considered by experienced prescriber. Final, no one can know everything. That is why, in all honesty, one must admit that no conscientious homeopathic doctor can practice homeopathy in a serious and really scientific way without a repertory. So without repertory, you can't practice actually. If you want to do a serious homeopathic, scientific homeopathic prescription, to meet the challenges of exploding materia medica, the homeopathic repertory was born. Thank you.
Thank you, sir, for a wonderful, insightful sessions on repertory. And I think we have missed 2-3 cases we may take up, and discussion session also. So it's a wonderful and motivating, inspirational, challengeable cases. See, so many students might not have witnessed such kind of results in homeopathy. That is what is needed, and what even NCH is also willing in CBDC program. At least you start using it, you start appraising it, and repertory is a tool which can help you ready to make references. See, use of repertory always makes us or rewarding us. I remember, I still remember one case of my early practice. It was a case of chondromalacia pateli. It is an autoimmune disorder of knee joint. And advanced pathological conditions. That she was a sister of an orthopedic surgeon, and she was having a radiologist brother-in-law also. And they have tried a lot of things. No age, but there was tremendous pain in the knees. And I was like, homeopathy ma che kaya evu? Let me see. I just took the thing, pain in knees, aggravation, what typical modalities, aggravation first, motion, amelioration, continued motion, activity amelioration. I was just sharing with Praveen Kumar sir. Okay, it gives me a picture of which remedy? Rustox. I didn't give Rustox. Because I tempted to check one symptom. There are two aspects in the repertory which is very much essential. If you don't know, if you don't do the preamble work, and if you jump into the repertory or materia medica, you will be blasted. You will not get the results. And then we blame homeopathy. Homeopathy is not working, or it's slow. I just was rewarded by the statements. He said, કે મને હું કાંઈ પણ કામ કરું ને તો મને સારું લાગે. So I was in a receiving mode. કે what? શું કામ? તો હું કાંઈ પણ કામ કરું. મને પછી તો એનો કેસ મેં ડિટેલ એનાલિસિસ ઇવેલ્યુએશન કર્યું. But that one segment, I tried to refer it into the repertory. Activity ameliorates, not the motion ameliorates. There is a difference between two symptoms. An activity ameliorate doesn't mention Rustox. It mentions Lilium tigrinum. And I prescribe Lilium tig 31 dose, and you will be surprised, within a week, 80% improvement. So, Rustox આપી દીધી હોત તો હું કહેત કે ભાઈ આપી એની જગ્યાએ Lilium tig has produced the result. So I always say homeopathy never fails. Homeopath fails if a case doesn't produce results. So always try to be in a receiving end to listen. The way Tiwari sir said, MLWS says, કે just listen. अपना internal voice को sound करो. That is aphorism 6. देखो क्या suffer कर रहा है. One more similar case, I just listened that case, I didn't prescribe anything. And what sir says, how well taken case is, I have done the job. It has completely cured the case without giving any medicine. So that was also that happens. And nowadays concept of homeopsychotherapy has also been coined by Dr. Sankaran, who has beautifully illustrated these things into the things. So there are various methods and the systems, but fortunately, as a student of, હું એવું કહું છું કે તમે જ સ્ટુડન્ટ નથી, we all are students of homeopathy. After this much of years of experience, no one, these teachers will also say that we are a student of homeopathy. प्रवीण कुमार सर बोलता था कि I need to, सर बोले कि मारे नहीं, मारे सुनना है सर को. Why? सीखना कभी बंद नहीं होता है भाई. You focus, and that is the reward which we are all getting. Thank you very much for this wonderful session, sir, both of you. આપણે ઇન્ટરેક્શન ચાલુ રાખશું. તમને સૌથી વધારે આમાં તમારે સાંભળવા તમારા ઘણા ક્વેશ્ચન્સ આવી ગયા છે, અને એક સરપ્રાઇઝિંગ ક્વિઝ બહુ ફર્સ્ટ ક્લાસ છે. તમને લાસ્ટમાં એવી જે લાઈવ ક્વિઝ કરશું ઇન યોર મોબાઈલ એન્ડ ઓન ધ સ્ક્રીન, અને એમાં જે લોકોને પ્રાઇઝ મળશે એને વિલ બી અવોર્ડિંગ વિથ ધ ગિફ્ટ્સ. સો આ સેશન એટેન્ટિવલી સાંભળજો, એમાંથી જ ક્વેશ્ચન્સ હશે. અત્યારે આપણે લંચ બ્રેક માટે છૂટા પડીએ છીએ. વિધિન 40 મિનિટ્સ વી નીડ ટુ કમ બેક, અને ત્યાર પછી દાસ સરને સાંભળશું, પછી પેનલ ડિસ્કશન, ક્વિઝ, એન્ડ ધેન વી ડિપાર્ટિંગ. થેન્ક યુ. ગો ફાસ્ટ, કમ ફાસ્ટ.
Thank you, sir. We request all of you to proceed for lunch and please return by 1:15.